Okay. So, first of all, thank you, Magnus Group, for giving me opportunity to share my views on the topic Nature's Pharmacy, Phytoconstituents for Cardiovascular Wellness. I'm Dr. Geeta Deswal from Guru Gobind Singh College of Pharmacy, Yamunanagar, Haryana, India. So, first of all, what are cardiovascular disease? Cardiovascular disease are a group of Cardiovascular diseases are a group of disorders for the heart and blood vessels. Coronary heart, cerebrovascular disease, peripheral artery disease, rheumatic heart disease, congenital heart disease, deep vein thrombosis, and pulmonary embolism. Cardiovascular disease account for 17 to 17.9 million deaths annually. It was reported by WHO in 2023. Current drugs, for example, statin beta blockers, can cause muscle pain, liver damage, and hypotension. Medicinal plants are used for centuries, which offer multifunctional bioactive compounds. 80% of the global population still relies on traditional medicine as per WHO. CVD risk factors. First one is hypertension that affects 1.28 billion adults worldwide. High low density lipoproteins, cholesterol, major cause of atherosclerosis, inflammation, elevated CRP linked to heart attacks, diabetes, which increases cardiovascular disease risk 2 to 4 times, obesity and inactivity accounts for approximately 30% of heart disease burden. So today we are talking about first phytoconstituents, which are used for the to cure CVDs. Phytoconstituents are the chemical compounds that occur naturally in plants. Some are responsible for color and other organoleptic properties. Flavonoids found in 6,000 plant species, antioxidant and act as anti-inflammatory. Alkaloids, they are basically nitrogen-containing compounds, for example, berberine. Saponins, they reduce cholesterol by binding bile acids. Polyphenols inhibit low-density lipoprotein oxidation. Terpenoids, over 40,000 identified, many with vasodilatory activities. Role of antioxidants in cardiovascular diseases. Oxidative stress accelerates atherosclerotic plaque inflammation, and they restore nitric oxide by improving vascular tone. For example, flavonoids rich diet reduced cardiovascular disease risk by 20 to 30%. Next one is flavonoids. Flavonoids basically protect the heart by, for example, quercetin, which decrease systolic blood pressure by 5 to 10 in hypertensive patients. And next one is catechins, which also decrease LDL by 10% in controlled trials. They act by the mechanism of by inhibiting LDL oxidation, by the improve of anabolicity, and by reducing platelet aggregate. Next one is adults. They act as multifunctional to cure the heart, like berberine, which also decrease the level of low density lipoproteins by 25% comparable to low dose statins, and also increase insulin receptor expression. They also improve AMPK activation, which is the key for energy regulation. Next one is saponins. Saponins basically lowers the low density lipoproteins in form of insoluble complexes with cholesterol in intestine. tribulus extract, they decrease total cholesterol by 30% in rats, common in legumes, oats, and ginseng. Garlic saponins lower the lipid and also lowering the cholesterol level. Genocides are lowering blood glucose, also improve insulin resistance. Curing T saponins, they also decrease serum lipids, improve lipid metabolism. Role of tannins and polyphenols. First one is resveratrol. They decrease CRP and IL-6 levels, inhibits COX-2 and NF-kB pathways, shown to prevent LDL oxidation and enhance endothelial function, improves SDL levels, that is good cholesterol, and reduces clot formation. Terpenoids, they are natural vasodilators. For example, ginzosides from panax ginseng enhance nitroxide production, lowers blood pressure by 10 to 15 in hypotensive models, also exhibit anti-thrombotic properties via platelet inhibition. And in combination, phytoconstituent, when given in combination, they shows a synergistic potential. For example, berberine, when given with silymarin, it enhances lipid lowering. Silymarin improves, basically, silymarin improves viability of berberine and supports hepatic lipid metabolism. Similarly, when curcumin is given in combination with piperine, curcumin is a powerful anti-inflammatory activity and antioxidant activity. Piperine enhance the activity of curcumin. Then garlic extract, when given with omega-3 fatty acids, it improved blood pressure and triglyceride control. Ginkgo biloba, when given with panax ginseng, it improved blood flow, memory, and muscular tone. Synergy also observed in polyherbal formulations in Ayurveda and the traditional Chinese medicine. Multi-target effects, lipid control, inflammation, and vascular protection. There are some limitations or challenges in utilization of phytoconstituent. First one is poor viability. Curcumin shows less than 1% oral absorption. Lack of dose standardization, which hinders its clinical use, a limited large-scale randomized controlled trials, and regulatory ambiguity for herbal therapies in many countries. Here are some future directions like nano formulations. In case of curcumin nanoparticles, it increased the viability by 20 times. Standardized extracts, for example, epigalloctacin gallate from green tea. Integration into nutraceuticals and functional foods. And as we all know, global shifts toward evidence-based traditional medicine. So in conclusion, I want to say that phytoconstituents offer safe, holistic cardiovascular disease protection. Their diverse mechanism address multifunctional pathology for cardiovascular disease, and its strategic use can complement conventional therapy and lower global health burden. That's all. Thank you so much.